This week at Progressive Pediatrics. Today is October 1st. For the last couple of weeks, we have had many children come to our practice with common cold symptoms. What is going on in New Jersey right now? There still is some COVID happening in children and in adults, not as much as it was earlier this summer. However, we are seeing a lot of kids with RSV. What is RSV? It stands for Respiratory Syncytial virus. It is a common cold virus that causes something called bronchiolitis in children, mostly in babies. It is usually not dangerous, but for babies who are born early or premature, or for people who are predisposed to having wheezing or asthma, it can be a little bit more serious. The great majority of kids who have RSV, they will have a cough that is very wet and productive for about 2 weeks. It will go away and nothing terrible will happen. If the cough is very severe, if it's severe enough to cause your child or baby not to be able to eat or sleep, that is when we worry about RSV, and we need to see your child to help them feel better and to assess if all is well or if a hospitalization is necessary. So don't panic if you hear the word RSV. I mean, the letters RSV that stand for Respiratory Syncytial virus. It is a very contagious, common virus in children, and of course, adults can get it as well. It causes something called bronchiolitis or a chest cold in children, and it is easily treated with some nebulization, mostly of saline, which is salt water. No antibiotics are necessary to get rid of RSV. It is something called a self-limited viral illness that for the most part doesn't cause major damage, but there are some babies or children that we need to assess and make sure that they are okay and that they do not need to go to the hospital. So if you have a child, especially under the age of 2, who has a very wet cough and you don't know what's going on, we would be glad to help you figure that out at Progressive Pediatrics in Union City and Bayonne, New Jersey. We're open 7 days a week in Union City, 5 days a week in Bayonne to help take care of your children. And we would be happy to see you. We are at progressivepediatrics.com, where you can find our phone number. You can also use our patient portal to make an appointment. So we're hoping that we are having a healthy fall. Have a great day. Bye-bye.